I think in terms of those, 5 priorities, I roughly would agree with those in terms of, patient access, in terms of increased access for those who have a need and right to the information, that's clinicians and patients, putting the kind of frameworks in place, and the standards in place to be able to achieve that, and also thinking about the platforms and the information structure and framework that's in place, not only for today to help improvements, but also for the future in terms of what's coming, the business intelligence, the automation, and those types of things. The increasing thing is, efficiency as well, and the NHS on a daily basis. How will it make it more? How can our information technology make it more efficient? And how can those frameworks alleviate the pressures and strains that the NHS has on a daily basis? And so there's a lot of things within there, and I think he also said we want to deliver stuff. Do the things we'd say that we were going to do and deliver those, and that's important as well. In terms of making sure sometimes it's all about small projects, and then sharing the benefits of those small projects and repeating them. Don't just start again and repeat the project again and start on a blank piece of paper. Just really looking at those and sharing the information. Again, it comes back to the frameworks. If you've got, for example, within AGFA's case, an enterprise imaging framework in place across a trust or a range of trusts, that's basically the infrastructure that hits. If that's robust and the governance on that is appropriate, then putting things in terms of AI on top of that is relatively straightforward, and that's the kind of examples that we're starting to do already in terms of looking at the AI concept and looking to see how can that add value and benefit to clinicians and healthcare professionals to help them do the job. It's not about replacing clinicians, it's about assisting them and supporting them to do their job and alerting them to potential more information that they could see. So I think you can't just put AI into a silo and expect it to do something. It needs to have a robust and framework below it with a governance structure around the information. That's another interesting question, and are we all ready for GDPR? I mean, that's, you see headlines on a daily basis about information governance and sharing and inappropriate sharing and those types of things. I think, again, it comes back to that framework thing, and this is kind of an underlying thing with kind of a lot of my answers. If the framework and governance is there, then it becomes a lot easier to do. Now, the challenge that the NHS will have in terms of what is that unique patient passport, we have the NHS 10-digit number, so that's a unique identifier. But for example, how is that linked to like government gateways or other gateways that we use for our taxes, our pensions, or whatever? Is there a unique patient passport type of thing? Or if we look at patients accessing services, how will they access services with unique identifiers? So those, once you've got that framework in place, those things become a lot easier to do. That is the fundamental behind it. Otherwise, it's a lot of data and a lot of data in a lot of silos. I think the rate of change in the next 3 years, it's almost like we don't necessarily know what's going to be there in 10, 15 years or potentially in 3 years. So it's making sure that and I come back to the frameworks and the technology that support change and easily adapt to change. So it's about building on top of what you've got and the infrastructure you've got and the frameworks you've got. Now, if those are robust in all the things I've said before in terms of governance and the way it works and the sharing and the standards-based, new technology on top of that will continue to add value. AGFA HealthCare's products very much are built upon a framework and a development framework to allow both now and future technologies to be easily adapted. And that's very much about sharing information to those who can have access to it and should have access to it, and whether that's a clinician or a patient. And that's across boundaries as well. So it's not about locking it in silos, it's about building a framework that allows good governance for all the things we've talked about, and also allows accessibility for all those who have a right to and a need to. I think this is probably about the third or fourth time we've attended these events, and we find there's a really high level of delegate in terms of key decision makers to enable us to have the right conversations both at a strategic and a more in-depth product level, to be able to talk about the things and the future of the NHS, the product developments we're doing, the work we're doing within the NHS to help deliver patient care. Effectively, that's what AGFA HealthCare does. And so if we can have access through ELS to those involved in making the decisions to deliver better care and how IT can help that, then that's a significant benefit for us. And the small events with a quality delegate really adds value for us in helping those conversations.